This video is about rabies in humans. For rabies in animals, see rabies in animals. For other uses, see rabies, disambiguation. Rabid redirects here. For other uses, see rabid, disambiguation. Rabies is a viral disease that causes encephalitis in humans and other mammals. Early symptoms can include fever and tingling at the site of exposure. These symptoms are followed by one or more of the following symptoms: nausea, vomiting, violent movements, uncontrolled excitement, fear of water, an inability to move parts of the body, confusion, and loss of consciousness. 16781 symptoms appear, the result is virtually always death, regardless of treatment. The period between contracting the disease and the start of symptoms is usually 1 to 3 months, but can vary from less than 1 week to more than 1 year. The time depends on the distance the virus must travel along peripheral nerves to reach the central nervous system. 9. A man with rabies, 1958. Specialty infectious disease symptoms: fever, fear of water, confusion, excessive salivary secretion, hallucinations, disrupted sleep, paralysis, coma. 1-2 hyperactivity, headache, nausea, vomiting. Anxiety. 3 causes rabies virus, Australian bat lyssavirus. For prevention: rabies vaccine, animal control, rabies immunoglobulin. 1 treatment supportive care. Prognosis virtually 100% fatal after the onset of symptoms. 1 deaths 59,000 per year worldwide. 5 rabies is caused by lyssaviruses, including the rabies virus and Australian bat lyssavirus. 4 it is spread when an infected animal bites or scratches a human or other animal. 1 saliva from an infected animal can also transmit rabies if the saliva comes into contact with the eyes, mouth, or nose. 1 globally, dogs are the most common animal involved. 1 in countries where dogs commonly have the disease, more than 99% of rabies cases are the direct result of dog bites. 10 in the Americas, bat bites are the most common source of rabies infections in humans, and less than 5% of cases are from dogs. 110 rodents are very rarely infected with rabies. 10 the disease can be diagnosed only after the start of symptoms. 1 animal control and vaccination programs have decreased the risk of rabies in dogs in several regions of the world. 1 immunizing people before they are exposed is recommended for those at high risk, including those who work with bats or who spend prolonged periods in areas of the world where rabies is common. 1 in people who have been exposed to rabies, the rabies vaccine and sometimes rabies immunoglobulin are effective in preventing the disease if the person receives the treatment before the start of rabies symptoms. 1 washing bites and scratches for 15 minutes with soap and water, povidone iodine, or detergent may reduce the number of viral particles and may be somewhat effective at preventing transmission. 111 as of 2016, only 14 people were documented to have survived a rabies infection after showing symptoms. 1213 however, research conducted in 2010 among a population of people in Peru with a self-reported history of 1 or more bites from vampire bats, commonly infected with rabies, found that out of 73 individuals reporting previous bat bites, 7 people had rabies virus neutralizing antibodies, rVNA. 14 Since only 1 member of this group reported prior vaccination for rabies, the findings of the research suggest previously undocumented cases of infection and viral replication followed by an abortive infection. This could indicate that in rare cases people may have exposure to the virus without treatment and develop natural antibodies as a result. Rabies causes about 59,000 deaths worldwide per year. 5 about 40% of which are in children under the age of 15. More than 95% of human deaths from rabies occur in Africa and Asia. 1 rabies is present in more than 150 countries and on all continents but Antarctica. 1 more than 3 billion people live in regions of the world where rabies occurs. 1 several countries, including Australia and Japan, as selected.